Welcome to today's program titled Open Enrollment Preview, How Lessons Learned Can Help Insurers and Brokers Win on Exchanges. At this time, all participants are in a listen-only mode. Later, we will conduct a live question and answer session, and if you wish to ask a question live, you must be listening to this webinar on the telephone at that time. For those of you who are logged into the web presentation, you are encouraged to submit questions throughout the conference by selecting the chat pod located in the lower left corner of your screen, and then type and send your question that way. For optimal sound quality, it is recommended that you listen to the conference via your telephone. Please don't forget to turn off the computer speakers if you choose to listen over the telephone. Look at the top left-hand column and click the speaker icon to turn the computer speakers on and off. If you choose to listen to the conference through the computer speakers and you experience any problems with the internet sound quality, please dial back in on your telephone. Now I'd like to introduce our host for today's call, Steve Davis. Mr. Davis, you may begin.
Thanks, Wendy. Hello and welcome to our Open Enrollment Preview. Today's free webinar is sponsored by Softheon. This is the third in a four-part webinar series. I'm Steve Davis, Managing Editor of Inside Health Insurance Exchanges and the AIS report on Blue Cross and Blue Shield plans, both of which are published by Atlantic Information Services in Washington, D.C. For public insurance exchanges, the start of the third open enrollment season is just 26 days away. For 2015, about 10.2 million people enrolled in coverage, but millions more are eligible and remain uninsured. And on the private exchange side, it's estimated that about 20% of Americans will purchase employer-based coverage through a private exchange by 2017. Today we'll take a look at the enrollment potential in both private and public exchanges, as well as the challenges and opportunities for health insurers and brokers. With me today is Eugene Sayan, the founder, chairman, and CEO of Softheon. His bio is in your materials. You should have received an email containing a web link to the materials. It contains an outline for our program, the slides, and some background information. If you did not get the packet, please click on the Presentation tab to the left of your screen, and you'll see a copy of the presentation materials that you can print out. After the presentation, we'll open it up for your questions. And with that, let me hand things off to a very busy Eugene. Hi, Eugene.
Hey, Steve. Thank you so much, everybody, and we do appreciate very much so, Steve, and thanks to you and Shelley. Good afternoon. Again, my name is Eugene Sayan. I'm the founder and principal here at Softheon, and today's topic will be about discussing kind of in preparation of the 2016 open enrollment, as Steve's put it out. It's less than a month away. It's been the third one, a lot of lessons learned, and we would love to share some of that lessons learned with the audience, both on the carriers as well as the broker side. We place a great importance on the brokers because we believe they are a critical part of the puzzle, if you will, being that the health insurance is kind of, at least on the insurance delivery side, is that being transformed into what we call it here as a supply chain or consumerization in a broader sense. So without further ado, a little bit of background on the Softheon side. Softheon is been in here since 2000, 15-year-old company. Our focus is on technology. We are a U.S.-based organization. We do 100% of our development here right out of New York, but throughout the country as well. Our focus has always been around innovation, coming up with a new product and services. In our case, that our ability to participate in early days of, let it be, transactional processing, which basically is the linchpin of a consumer-oriented real-time processing, as you will imagine, but all the way down to some statistical analysis and everything else. And we will share some tools and products throughout the presentations. If for those of you may in fact know us by our newsletter, Connector newsletter, if those of you haven't, we will love to have you come and visit us online and subscribe to our exchange newsletter. It is a daily newsletter that we curate various groundbreaking stories, and we will love to share that with you on a daily basis. So today we are also proud to say been collaborating and working very closely with over 50 health plans for various exchange-related issues, let it be on the technology side or on the operations side. 5 areas of interest to Softheon, or value proposition, if you will, from Softheon perspective. They are in HICS integration, As I mentioned, that we have been working partly with 50 or so health plans, helping them with various aspects of their federal and state exchange integrations. That includes all the way from initial QHP filings and SBC generations all the way up to daily 834s and soon to 820 processing, and that also includes other aspects, including like premium billing. And private exchanges are part of our value proposition working with our health plans. We provide both single and multi-carrier exchanges, and we will again talk about those in length as well. Direct enrollment is a tool, as you know, is a platform, is designed to provide offerings to subsidized population in the form of tax credits, and for that, our private exchanges are fully integrated, therefore giving the carrier and the brokers ability to provide subsidies on those QHP products that are available through the private exchange experience, minimizing the time and effort spent on healthcare.gov. In that sense, we would like to engage with the consumer through the carrier or broker branded websites where the consumer are able to come back and continuously engage with us. 8server is a linchpin of probably the biggest talking point of today's presentation will be around the data gathering and analytics. I'm sure that you're all hearing some signs of volatility in the space, especially on the carrier side. Let it be the issues around the co-ops, or in general, organizations like Highmark Blue Cross posting $300+ million losses associated with the ACA implementation. So clearly, there are some volatility, but as we view it in here, whenever there is a disruption volatility, that's where we see the opportunity to excel and truly, to a certain extent, bring innovation to that value proposition. As we proceeded into this thing, one of the other differentiators that we would like to place upon the importance of new methods of technology implementations and delivery. Being a cloud-based company, most of our implementations, if not all, it literally takes about 30 days or so. In other words, that within 30 to 60 days, we are able to onboard any new carrier, basically, or brokerage firm, for that matter, or private exchange of any size, to participate in the federal and state exchanges. That includes their entire underwriting, fulfillment operations, as well as premium billing components to it as it relates to the invoicing and payment collection, as well as the federal and state compliance issues. And we'll talk more about the cloud concept, how it really applies to it. Kind of peel the onion, if you will, and there's a lot of the things. And this slide, what is really noteworthy is what you see on the top right corner, where our engagement, so to speak, is limited to just literally 2 arrows you can see moving out of the in and into carrier block altogether. So in essence, that the entire exchange operation, all the way from initial, again, implementations to ongoing operations and compliance, it all takes place basically on the Softheon cloud. So what is really in Softheon cloud is another way to describe what we do today, is the platform ultimately we view as a wholesaler. And really what that means. Just as today, and in the best example of this kind of an architecture, if you will, and this is, again, I think is a crucial takeaway from this presentation, or in general, about the holistic view of an exchange architecture, both from a brokerage perspective as well as from a carrier perspective. So we do know that most of the carriers, except those, have taken maybe a little deeper kind of a step into this thing. Implement today what I would call it a peer-to-peer communication in here, carrier talking to the exchanges. to us, that analogy is what I would call it a farmer's market analogy. Is there you bring your product and produces directly to the consumer, and you try to deliver that product on a timely basis and try to sustain the operations. Whereas the value, we believe the holistic approach value is about wholesaler approach and with a true supply chain distribution approach. In this context, as you can see, Softheon already has established relationship with pretty much every federal and state exchanges. We are now talking about private exchanges. We have a couple of slides to talk about that later down the presentation. And on the carrier side, again, having been in the business for 15 plus years, and I must say that the first 13 or so years, really our focus has been around kind of implementing various platforms and products around the core admin systems, such as Facets from TriZetto or QNX or Amesis DST, ICA, Health Edge, Monument. So all these core admin systems have been kind of, again, as I said, was an important factor of the health plan's success in healthcare. But just like an old saying, what made you successful yesterday doesn't guarantee your success tomorrow. So we believe these tools need platforms, like an intermediary platform such as Softheon. So through the experience that we act as rather than asking our carriers to do, again, farmers market analogy versus the true distribution channels. So I'm happy to say that today some of our carriers, in fact, are no longer need to be concerned with who are the retailer, who are the exchanges that they are integrating, because they have one integration point, that is us, Softheon, and our job is to generate as much consumer retail experience for the membership for that health plan. And since we are incentivized or paid on just as the broker relationship, on the revenue side, in other words, we don't impose fees and dues on the cost side per se. Our fees are directly based on a contingency of the membership that we drive through the consumer retail experience. So we have, again, as I said, presence in every part of the country, working with every federal and state exchanges, and over 50 health plans now trust Softheon. So if I may, there's only about, I believe, 240 or so health plans going to be participating in FFM. Safe to say that over 15-20% close to of that supply, if you will, has already participating in Softheon's distribution channel model altogether, and we're providing those products to all the retailers, in this case, mainly the federal and state exchanges. But again, we're focusing on other areas as well too. So let's say shift the focus, not just about Softheon. I think the purpose of today's presentation, as well as what is really happening in the overall marketplace. We know that the volatility around the ACA will continue probably through the end of 2017, having cleared the final hurdle, King versus Burwell, if you will. We believe that there's not going to be a lot of opposition. I think the repeal conversation for the time being will be subsiding with the all focus now shifted towards the presidential election. So even with the event of a new election coming in, we believe that the result of that election will not really make any impact, since the open enrollment will be nearly halfway through by January of 2017. So I think it's safe to say that we have 2 more open enrollments ahead of us in this current model altogether. And so we know that the public exchange markets is kind of reaching to a little bit of a saturation point. Again, there were some references made by CBO, Congressional Budget Office, with a projected ACA membership to reach 20 million. Recently, HHS revised that projection, lowered it more like a 12 to 13, 14 million range. In any event, I think that the ACA markets are going to be tapping into 15 million or so. But we believe the private exchanges will continue to given the momentum that ACA has created, is continue to gain speed and traction. And in fact, it's one of the areas we're going to talk about, the importance of the brokers to be able to serve to both subsidized and non-subsidized population through the unified exchange platforms. So going back to that prophecy, if you will, this is the Gartner's hype cycle, commonly referred as more like a prediction or a prophecy. And as you can see, that there are two categories that we continue to play a critical role. One is being the public exchanges, and that's, again, converging with private exchanges as well. And the other one is the ability to generate and consistent consumer engagement, starting with efficient and effective invoicing and payment platforms. Pleased to say that, we've been recognized in these two categories by Gartner. So as we proceed into the other areas, I mentioned about private exchanges. We believe the momentum will continue to shift towards that. According to EBA's magazine publication, actually now they have a private exchange index, and Softheon and our brands are one of the exchanges that basically contributes to that index. We have been recognized. We've also formed a founding member of a coalition by not just about Softheon, but other industry-leading private exchange technology companies like the Blooms of the world and Ray Health. And we're always, proud and privileged to be in the category of innovators, if you will, and try to create a kind of a unique ways and disruption to a certain extent in this otherwise very much a traditional model of delivery. Again, for those of you who may or may not know, Oliver Wyman always represented as the kind of, again, the forward-looking thought leaders. Once again, we'll be also recognized by Oliver Wyman as well in this category. So given our track record and implementing the very first playing a critical role in the implementation of the nation's first state exchange to this date, we have continued to gain a lot of insight. So let's talk about what those are and what the market is. Obviously, this is an interest to you that we're very pleased to see. We have a very nice attendee list for today's webinar. And as you can see this is a multi-billion-dollar market. And again, it's a combination of, given the fact that 18% of our GDP is spent towards it, the health insurance services and delivery is really represented in so many different ways that can actually affect 100+ million lives over the next several years, as being predicted by Accenture and McKinsey and others. Of that, as we mentioned, the 10 million is in ACA, and we will go through the next open enrollment. So the next couple of slides, we'll talk about what are the effects of that, the kind of lessons learned from where we are today. Again, the numbers, we don't know whether it's going to be about 12 million or 14, or perhaps that CMS and HHS want to take a more conservative approach compared to the last two open enrollment. But nevertheless, that I think that the exchanges are here to stay. And again, as I said, the transition to the public exchanges will continue. What is really interesting about that, there are going to be a number of carriers are entering into the exchange has subsided significantly. And I think one of the reasons of that was that we've seen that there are a lot of carriers are deferring their entry into the ACA either 2017 because the fact that King versus Burwell kind of forced them to stale, if you will, until end of June, and that really created a lot of anxiety, and many organizations are contemplating. So our reach out to them, there are some options, and Softheon being one of them. If you have already filed for your QHPs, that we would love to hear from you about how we can still help you achieve the ability to integrate with ACA for 2016 open enrollment. If not, we're always here to any way we can add value to your operations. We look forward to having that conversation with you. Marketing on the private exchanges, again, as I said, it's going. Accenture's latest numbers, a little over 6 million people enrolled. It's difficult to keep track of it because the fact that information is kind of in so many different silos, all the way from some of the large group multi-carrier private exchanges efforts that we're seeing on the Aons and Tower Watsons of the world, as well as some other entities, a lot of the eHealth or GoHealth and fee order organizations are heavily investing into the private exchanges. From our point of view, we have about 10% of our membership right now is in private exchange, and we see that number is growing exponentially, and where the shift will be basically moving at the direction of private over the next 18 months, meaning more membership probably will be enrolled through private exchanges based on the interest level from both the broker communities as well as the small and large group organizations. So what are those challenges? So let's go back to one of the few things that I think the cost of membership operations and retainment on ACA and exchange-based membership is much, much higher than the Medicare and Medicaid side. And there are multiple factors. As you can see, all the way from the sales or marketing, we've seen organizations that in the past really didn't have to spend any money on the marketing aspect per se if they were in Medicaid, traditional Medicare and Medicaid plans. Commercial plans had some basically operational units and expenses in that area, but nothing like an individual consumer-driven markets as we are seeing today. The big another factor, 47% of that $30+ PMPM is actually allocated towards an ongoing operations. Again, organizations perhaps was across the board a consumer sentiment. When an individual was enrolled in an entitlement program, let it be Medicare and Medicaid, they seem to be less forgiven, if you will, or more forgiven, I should say, in the event of their membership statuses or not having their ID cards and whatnot. But now the consumer actually making even if it's a dollar payment, it could be 90% subsidized, 95% subsidized. But because they are making a payment, and because the fact that in a certain extent maybe the expectations were raised so high that they are now expecting a better service, the same service that they will expect from Amazon or Expedia or their online banking. So this is creating a tremendous amount of stress. So another notion about that, there are very little tools available to consumer to engage in a self-serving methods. I will use the ATMs. I don't remember when was the last time I actually went to talk to a bank clerk. I don't do it anymore. I go online or ATM. So the type of tools and services, lack of it, I should say, it is exasperating the expense of member service operation. And then there are new services, new fees that health plans have to contemplating, especially around the fees around fulfillment and monthly invoicing fees, fees around credit card processing. In fact, we'll see in a short slide or two that significant number of members, based on our records, actually make their payments via credit card. Well, that's fine unless you have taken into the account of 3 to 5% merchant fees, your credit card vendors are basically applying on top of it, and as per ACA, you cannot pass those fees, convenience fees, as a surcharge to the consumer. So those fees has to be included as part of your actuarial models altogether in your premiums. So there's a lot of, these are 3% of a premium of $300. There's a lot of money. That's $9. That's a significant portion of fees that may be even added on top of these fees as we have shown in here. So we believe that through the use of technology, proper use of technology, and adopting the best practices, rather than trying to building your own, as I said, a services and distribution channel, following the quote-unquote the farmer's market analogy, we've seen across the board some of our carriers on an average have savings of $3.46 per member per month. So technology can be used in a wise manner and sufficient manner that will help you combat, and therefore you'll have higher margins for your MLR as you are constantly battling with the adverse selection or other implication related to the risk factors. So in that context of it in the ALRs, and again, the areas that you wanted to do is you want to diversify between the on-exchange, off-exchange. So for a typical carrier, this is an important topic because what you want to do is, again, creating a healthy balance as you shifted your membership towards more private exchanges. There are some immediate benefits. Perhaps in one of them is that you don't have to pay the federal and state exchanges the administrative fees. And conversely, you have to have maybe a lot more on the marketing sales side about, once again, accepting and adopting a platform with best practices may help you alleviate some of those expenses through the platforms, again, as I said, like the ones that are Softheon providing. By the way, the screens that you're seeing here is actually taken out of literally from our dashboards. This is the kind of visibility that we do create for our insurance carriers, even and brokers, so that they are able to kind of get a pinpoint accuracy, near real-time accuracy for their exchange operations. Adverse selection is a critical factor. This is a perfect slide in here. So clearly, a guidance that we issue for our health plan executives, if you happen to be this health plan, we will urge you to look into your member demographics, and there might be issues with adverse selection, and we'll see a few slides down the road how that 51 to 65 group affects in your membership's claims utilization in that context. And again, as I said, we talked about the references to the credit card processing altogether. On the payment side, there was a lot of challenges in here, as we all know. Again, running a bad invoicing is going to exacerbate your member service operation with hundreds of thousands of members complaining about their inaccurate invoices. Or a member making a payment is not being reflected on their invoices. It's going to create a lot of unnecessary, again, customer service member experience altogether too. And so you wanted to be able to kind of, to see the curve, see the trend. In this slide, what you're seeing is basically your typical payments, and you can see here, just to show you a trending month over month, it shows that basically we're seeing more people, they defer their payments in August, and surprisingly, maybe not so surprisingly, because people go on vacation and they don't open up their invoice on a timely basis. So as a result, that you may have a high rate of delinquencies in your September coverages. So your September claims may be falling to the pending claims. So again, this is the kind of analytics that you need to be able to get your hands around to be able, in order to create a sustainable and efficient consumer-facing both public and private exchange operations. Again, the similar thing applies to the pay-through dates. Once again, these people are going to be, if their pay-through dates do not get advanced, their claims will be pending, and this is a reflection of your pending claims. And of course, again, that will create maybe unnecessary traffic from your providers who are expecting to get paid and realizing that members have been on vacation, they did not pay their premiums, now they are delinquent, and now you're pending their claims. So there are a lot of dots, as we call it, needs to be connected in the world of consumer-facing exchanges, again, both public and private-facing. Another challenge that I think that the lessons learned and in preparation of 2016 is the impact of the 3 R's, also commonly referred. So as you know, the 3R programs, risk adjustment, risk corridors, and then the reinsurance, is a program that is a temporary program, 2 parts, only available for 3 years. And 2017 and beyond, then the carrier has to understand the reinsurance and the risk corridors. Once again, we talked about adverse selection in the context of the risk corridors. And again, this is the phenomena around the narrow network concepts that we are seeing kind of a way different ways to manage this risk, if you will, from health plan perspective. And as you know, the reinsurance is really the factor of the plans that are subject to or a victim of adverse selection. They saw a massive claims utilization in certain memberships. This is their way of just getting some of that money back from the federal government. We also know that, I think there's an article in this morning's Softheon newsletter, that the federal government is kind of, I think, a little behind making those payments again. For smaller carriers, about having a $14, $15, $20 million in reinsurance, that is a significant cash flow issue that you need to be ready and prepared to figure these out. Again, use of technology will be helpful. So this is an area that we're really excited about it, and what you are looking is actually our claims-driven data analytics. So what you are seeing in here, for instance, we are able to generate member-level P&L. That's one of our mantras in here. So we are able to actually, as a byproduct of our ability to manage enrollment, underwriting, premium billing, financing, collections, and now with the claims data, the utilization, the payments data to the providers, we are able to create some data models, being that is our focus and our core competency, I will say it, and being able to produce a very detailed analytics. So here you're looking at that basically that state map below behind. It represents a health plans and their membership across at each county level, and the colors indicating that the greens are, the darker the green is the more profitable, meaning that we have a good premium revenue but low utilization. The darker the red color indicating that low premium but high claims utilization. So you can see that as we call it, we are a product of our own environment here. So healthcare is no different. Obviously, individuals from kind of, again, poor neighborhoods may have a bigger challenge with the utilization. This is the first time maybe they have health coverage in years. So as a result of that, they're going to maybe overtaxing the system networks. Other areas are doing well. So again, taking the guaranteed issue component of eligibility away, we wanted to create a sustainable businesses. I'm sure that you're seeing again the news around the co-ops. Already a couple of them already shut down. Most recently, the largest co-op of its kind, the most successful once it was thought, is actually losing money severely just because the fact that they enroll so many members from poor neighborhoods. Again, it's a kind of a short-term gain for us in this model. Our goal is to create a sustainable model and leveraging whatever the tools available. Same kind of breakdown. We are able to do that on the, again, as I said, at the individual age bands as well as different type of demographics. So we're able to produce a profit loss P&L statements for at the county level. We can do this at the membership level, or we can do this at the different level. So this is another same slide, slightly different. Again, the areas that are shaded in dark green as a profitable counties, service areas. The ones that are in red are the ones that are losing money. And ironically, by the way, for a health plan of roughly about 10,000 or so lives on ACA, we've seen that as little as 30 people counts for 80% of the expenses. Now, most of them are the end of life, some of them are transplants, but the goal is to be able to giving you the tools to the carriers so that they can create their own strategies, their own wellness program, outreach programs. And in this case, the tools and the data and analytics that Softheon or companies like Softheon provide is truly is the game changer. Truly, this is where we are seeing the biggest innovation, biggest cost savings are being achieved through the use of data in every possible way. Another way to look at this data, you're looking in here, is mainly from in this case, the highest plan IDs. The plan IDs are being redact. Once again, tying that into the age band and male, female. So you can see, ironically, not so surprisingly, that basically we have this particular age band in here. So these particular highest plans, most likely gold plans, having some creating problems. There's a high utilization of benefits. But if you also look at it, then I think the bigger problem is the age bands, is that the 51 to 64 age groups. Ironically, I suspect that these are the catastrophic plans that we have a lesser claims utilization than other plans. So again, this kind of analytics in near real time at the fingertips of executive leaderships, this is the goal of consumerization. This is where, how, with all due respect, the Walmarts of the world, they are so successful. They use the data, and many times, Procter & Gamble may deliver toothpaste to Walmart, but Walmart knows exactly how to distribute those based on the stores that are high-achieving stores, like they always have it. They have low-achieving stores. So that's the kind of thought process, market analytics, that we urge our carriers as well as brokers who wants to create a sustainable and build a sustainable operation, because ultimately it doesn't serve anyone if the health plans are basically pulling out of the exchange. If nothing else, they're shutting down their operation. That will limit the choice. As the choice, we know that is limited, and then basically the price doesn't go down, as driven down as the competition will do. So the prices will go up and the choice will be limited, and so on and so forth. So once again, but what we are suggesting, what we are urging the industry to adapt, more analytics, true data-driven analytics. And any of you, by the way, if you have any like to have a copy of the slides, they will be available to you later down the road, but I will be happy to provide you a copy of it, and in fact, happy to have any kind of a consultation guidance that you may have questions about any one of the slides. We'll be happy to do so. On the last slide, I have my contact information. Again, so that we identify the challenges. Another challenge here, again, CBO projections may hold them true. So how are you going to handle twice the membership you had this year? Are you have the operational metrics in place? Do you have the human capital investments? Your IT systems, are they able to sustain the level of growth that has been experienced or being projected? Once again, using vendors like Softheon, we are able to do this. This is all we do. We are an Amazon cloud, but we are different than Amazon. We don't onboard any technology companies, any technology challenges. All we do is exchanges. All we do is public and private channels, and so on and so forth. So our best practices, our templates, our go-to-market is a little different than what I'm going to call it a commodity-based cloud platforms altogether. So using those platforms, as you know, one of the greatest advantages of cloud is elasticity. Elasticity means that it's not really your concern, and your vendor, cloud vendor, will normally sign up to a service level agreement on the uptime. For instance, our uptime service levels is 99.8%. So we are guarantee our system to be always up and reliable, regardless of how many enrollment transactions, how many invoices, how many IVRs are we taking through, given the period of open enrollment or after fact or the day of the month, depending upon the consumer engagement. All are covered under SLA by your cloud vendor. So those are the few exciting things about the cloud-based technologies. So again, the convergence of the market, another one. We believe that over the next year or two, the distinction between the public and private exchanges is done. For us, is an exchange if it's operated and owned by a federal and state entity. It's a public exchange because today on public exchanges, there's a small percentage of the population actually get their insurance as a non-subsidized. These are the members. They found the cheapest insurance on healthcare.gov or state exchanges, and they may not be qualified for any kind of a tax credit or subsidies, and yet they go ahead and buy the insurance. Small percentage, single digits, maybe up to high teens. But we're also seeing the same kind of interface on the private exchanges, and therefore our definition of a private exchange is an exchange is owned and operated by a private entity. That could be insurance carriers, it could be third-party entities like Softheon's wealthiest brand, we have it, or eHealth or GoHealth or Get Insured, or other vendors. We're seeing as the brokerage firms are trying to create their own exchanges for their, or the large groups, or even a medium, small-size organization creating their own private exchanges. But today the technology is nearly there. It's not the perfect, but you can enroll as subsidized memberships through private exchanges via direct enrollments. So we do this today. So for us, exchange really is just one thing, a no wrong door policy, and this is what we like, what we hear from most of the brokers. They like the idea of that, being able to go to a site, a platform, and depending upon the members' well-being, financial status, and demographics, they can go pick any one of the product available, all the way from Medicaid plans all the way up to fully commercial premium members. So we believe that the markets will continue to converge. And we are getting close to the opportunities. I'll wrap it up very quickly where the areas we believe that health plans should be considering it, especially carrier as well as broker. Choice is great, but you don't want to do it as a health plan to focus on these market retailers. Again, as I said, rather than building your own direct distribution channels, we urge health plan and brokers to adapt to as many different carriers altogether. And one of them is Wealthios. It's a new brand site. We approached it. It literally takes 2 clicks, 2, zip code and your age. By doing so, you're able to see all the product in the QHP. You don't have to go through the entire enrollment cycles altogether, give any kind of a personal confidential information. Once you make your selection, you will see the products. Broker portals, tablet technologies, mobile is a big thing. Payment platforms, mobile payment platforms especially. We're seeing an early adoption in the space. No more invoices, paper, no more even email alerts in paper format. And then basically ability to track the consumer, their behaviors, and the like those of the world. So just about 1:45, and we thank you again for your spending the time with us this afternoon. And for those of you on the West Coast, and thank you again for maybe over lunch hours. So at this point in time, I'm going to turn over to Steve for the Q&A session. Steve?
Great, thanks Eugene. And I'm going to turn it over to Wendy to explain the couple ways you can ask a question.
Thanks, Steve. Ladies and gentlemen, at this time we will conduct a question and answer session. To ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, and then type and send your question that way. If you'd like to ask a question via the telephone, please press *1 on your phone now, and you'll be placed in the queue in the order received. If your question has been answered or you wish to remove yourself from the queue, you can please press *1 again. And then I'll announce each caller prior to bringing you into the conference. Please remember that if you have your phone on mute, that you take it off mute when you're selected to ask your question. So again, to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, and then type and send your question. And Steve, we're ready to begin. And we don't have any live callers at this time, so I'll alert you if we do, and you can take the chat pod.
Great. Okay, we're wide open for telephone questions. And Eugene, going into something you mentioned, I think early on you mentioned that maybe there'd be 15 million people enrolled in the public exchanges at some point, and that would kind of be the cap. Is that where you see that going, sort of leveling off at about 15 million?
Yes, I think that we will see the numbers are going up slightly because of the increased tax penalties. We're seeing some aspect of Cadillac tax implications, and subsequently also the result of the immigration reforms. But we believe that the 15 million mark will be the kind of a glass ceiling for public exchanges.
And at some point, the private exchanges, you think, will far surpass what we have in the public exchanges?
Correct. We think that the public exchanges will, again, take the lead in 2016, 1 more 2 years. I think the latter part of 2017, especially after the election campaign, again, depending upon whether the Cadillac tax will be repealed or not, that will kind of really define the turning point, if you will, with the defined benefits and everything else. I think consumers are going to have much more product choices or channels, like the kayaks and Expedia available to them, especially on the small group market. And we all know that also some very creative companies like Zenefits doing this. Again, they are completely bypassing the broker community. That's one thing that we want to make it very different on Wealthios. We are in fact onboarding 160,000 brokers on Wealthios. We believe the brokers are key to the success, and we would like to continue to work with them. We want to give them all the tools that are available, following what Amazon does it in their Amazon store, or eBay with their eBay stores. They're giving the tools to those brokers and get them continuously engaged. And we believe that brokers are going to be the key differentiator about the increased private exchange memberships.
Okay, great. And you talked a little bit about the retail experience. How has the retail experience on the public exchanges, how has that changed? And I know it's changed quite a bit since 2013. And what have we learned as far as the consumer experience goes on the public exchanges?
So unfortunately, the whole healthcare debacle, if you will, really put a little bit of a bad taste in the consumers. And then it still has improved significantly from what it was today, what it was in 2014 open enrollment. So I think it's improving. It's getting better. But the progress has been just kind of a little bit of a slow progress, if you will. So the challenge really is that, is it too little too late? We believe that, again, just like Medicaid and just like Medicare, the private exchanges and other government programs will continue to have certain memberships. They'll have typical churning process as people go in and out of these programs. But I think that really the big thing is going to be the more and more private exchange adoption. So in a way, if you look at it back in 2014, high deductible health plans were growing about 18% a year on an average, and commercial was already declining on its way. So ACA kind of put a stop to that process a little bit. It diverted it. We believe that the consumer behavior will come in, and I think consumer will find a better engaging, better guiding tools on private exchanges than public. We believe is kind of the public exchanges is pretty much, as I said, hit their plateau in all aspects, not just the membership engagement, but also the use of technology and their ability to still confined within the rules of ACA, going through identity proofing and all those things, unless, again, there are some set of new deregulation comes in. And simple analogy that I make is, when you file your taxes, you don't go to IRS website. And somehow TurboTax is trusted by IRS, able to do that. Until that kind of a deregulation becomes really available in healthcare in general about healthcare.gov and CMS and CSIO, we are not going to find a lot of deregulations driven technologies as much of the innovations that TurboTax and H&R Block bring in to that business, to that kind of a challenge. I think in the absence of the deregulations, that the consumer engagement is going to continue to be I'm going to call it a mediocre, nothing more than, definitely not to the levels of 40+ million uninsured. We don't see ACA getting to those numbers anytime over the next several years.
Great. Thanks, Eugene. And here's a question for you. Do you see a growth in the public exchanges as small 50 and below employers drop their group health plans? And I think CBO initially, they expected about 21 million people by 2016 in the public exchanges. And it seems that a big part of that miscalculation was that I think there was an expectation that a lot of employers would drop coverage and send their employees onto the exchanges, and that really hasn't happened in the way that maybe was anticipated by some people.
And that is correct. So again, as I said, it's just the healthcare is a critical part of many organizations and of the employment offerings and perks. And given the bad publicity, if you will, healthcare.gov got it. I've spoken to many small to mid-sized organizations and C-level executives. The last thing they wanted to tell their employees, okay, you have to go to this, to this thing called healthcare.gov and go through the same kind of a frustration, if you will. Organizations that really value their employees, they will continue to provide them some kind of, again, as I said, coverage through the traditional methods. I think that the private exchanges, with the adoption of private exchanges like the Wealthiuses of the world, again, as I said, we're going to start seeing some small group coverages based on the words of benefits. So I think we're going to start seeing some innovation in that space altogether, meaning that consumer will go to the exchanges, but I don't believe that's going to be a public destination, but it will be more like a private exchange destinations as a multi-carrier private exchanges. In that context, that the small business owners will experience that firsthand themselves. And that's going to drive it. Another thing is about also the tax credit issue altogether. That's still a big kind of a question mark, and who gets it, what gets it in the small group settings. And I don't believe that's one of the reasons. I believe that's one of the reasons that also this phenomena, this prophecy hasn't really fully materialized itself.
Okay, good. I'm going to read this one to you, Eugene, and you can take a crack at it. Somebody asks, one safeguard of enrolling on a public exchange is that premium assistance becomes retroactively available should an unsubsidized consumer's household income drop below 400% of the federal poverty level. How is that addressed if a consumer enrolls wholly through a private exchange?
Okay, so again, I think that the key thing is right now, today, if you will consider as single carrier exchanges, and we operate about over 50 of them in here, by the way, and these are carrier branded exchanges, consumer facing exchanges, and through the direct enrollment aspect to it, we are able to enroll those individuals. Unfortunately today, there's an industry term, double the redirect, so we are forced to send the consumer, and this is why the broker is so important. If they're able to enroll with the assistance of a brokers, there is a higher success rate of enrolling someone through ultimately a private exchange, a carrier branded exchange, a single carrier, and some multi-carriers as well, like Wealthius being one of them, as I said. And then we are able to enroll those individuals through just as if they will do so public exchanges. But if you are looking to the just as a private exchange in this context, again, to enroll a subsidized and non-subsidized population, those methods are available. It's little less than ideal. As far as getting back to subsidy calculation, the exact amount, to be honest with you, subsidy calculations and sometimes may be based on a data that is 2+ years old. Today, that method is a little bit of still a kind of a gray area. It's kind of a little bit of a secret sauce per IRS. We don't really understand how they are calculating that amount altogether. We do follow the MAGI rules. All our portals, including Wealthius, will have a estimator component to it. I think that will be the first indicator to individual whether be able to come back and if their income changes, see if they are qualified for subsidy, and then if they are going to be able to maybe re-enroll. Again, there are a lot of provisions around the provisions around the special enrollment period. So whether that will be a life-changing event that will then enable or provide the consumer to be able to drop their current coverage and go back to a coverage with a higher subsidy. So that is all really a case-by-case basis. I don't think there is a one general answer to address that. The changes in your income levels and FPLs, and as well as the method that you enroll, that all have a kind of a different answer, if you will, on a case-by-case basis. I urge the audience to maybe reach out and we can discuss it on a more specific basis if they would like to talk more about it.
And you mentioned the double redirect process. Do you see that going away anytime soon, within the next year or so?
I think you and I have discussed this multiple times, and there was a lot in the pipeline, a lot of development effort, a lot of different upgrades and versions and whatnot. Unfortunately, has not happened. And this is another year we're going to go through double redirect. So in other words, consumer will be asked to go from one website to another website and then come back to this website they started from. It's a very kludgy ways of doing things. There are some conversation about opening up as a service, meaning just like a kind of a credit card approval, a simple thumbs up and thumbs down, and a subsidy amount come back as part of that web APIs. But right now, we have not heard any new update. We hope that becomes a top priority to our friends from the administration and CMS, because should they able to do that, I think that private industry will be more than happy to take the lion's share of the cost and operations of exchanges. And as I said, to us, that will be the defining entry point, that the convergence of public and private exchanges, because at that point, private exchange truly become a single entry point for both subsidized and non-subsidized population without losing that consumer and getting them confused going back and forth between the websites.
It sounds like that could be a game changer if that happens.
Indeed.
We've got time for one more question. This person says, how can Medicaid HMOs looking to become QHPs in the upcoming years benefit from a partnership with Softheon?
We love that question.
Yeah, I thought you'd like that one.
We love that question. We would love to. So basically, to be frank with you, our core competency here now is we provide a lot of consultancy services. Again, as I said, we're not a PwC, we're not a Milliman, but what we have built expertise in here, a deep understanding of the markets, the price points, the competitions. Again, I urge you to consumer our audience today to go to wealthios.com and just enter your zip code and your age. You will find all the plan benefit data altogether. So we help our plans based on all the way from benefit design and implementation, helping them filing with their challenges with the CMS. We know our friends at CMS. We know those kind of the effort, what it takes to be enlisted by our CMS trading partners. And on the return side, you don't need to, as our plans, don't need to build their consumer-facing operations by simply relying upon Softheon tools and technologies. It's truly a partnership. Again, as I said, our goal is to generate revenues, generate membership for you. And so we are selfishly, quote-unquote, incentivized to get those membership numbers going up there too. And we wanted to do so, obviously, with removing all the barriers, let it be operationally or financially, the barriers of implementing an exchange operations, and especially for our Medicaid plans, given that there are regional health plans, that there are staffing issues and financial issues. I'm happy to say that I think we have really a win-win-win formula, if you will. Our plans win, our consumer wins, and of course the Softheon wins by being able to create a very collaborative, very forward-looking operations and continue to disrupt the space.
Great. Well, we're at the top of the hour. I'd like to thank, first of all, Eugene. Thanks for taking time to chat with us, and also thank our attendees for joining us. And that's all we have. Any closing thoughts, Eugene? No. I think that other than, as always, we are very grateful for AIS for helping us reach out to these thought leaders. We are really exciting. These are exciting times. Again, as I said, I think that some may view it as a challenge. Look, you can, at the end of the day, you can be risk avoiders, or you can be risk managers. And if you look at the history is always on the side of the risk managers. So understanding what the risks are, understanding how to circumvent them, how to avoid them in most cases, how to minimize them, that makes all the difference. And with today's world, there's no better way to managing that risk through the use of technology, through the use of data. So I think that partnership with an organization like Softheon, I'm a big fan of AIS. All the numbers, we love those metrics that you published about that, because that's how we benchmark us against the industry standards, because what we want to be able to create a really kind of a high tide, low tide issue. This is not a one vendor solution. This is not a one carrier solution. I think that what you're going to be seeing over the years,
that the number of insurance carriers participating in exchanges will proliferate. We're seeing the signs already with the providers are getting into the carrier business, the ACOs, even large group, each one becoming their own little insurance companies in that sense. Consumers are definitely demanding more because they use Facebook, LinkedIn, Google every minute. They're looking for that kind of level of proficiency and control. And that is the only way the cost of healthcare will be then managed, giving all the stakeholders the power to make their decisions at the moment of the service. Ask your doctor, what is this costing me, this procedure? And then imagine able to look into your iPhone just as looking for Yelp critics and finding out the other doctors in your neighborhoods who may have a better rating and yet at cheaper fees. Those days are well within the reach. And so we are really excited to be part of this selected group of individuals. And we look forward to meeting you all at the next AAS webinar we are delighted to be part of.
Great. Thanks, Eugene, and happy almost open enrollment season. And thank you to all of our attendees. Have a great afternoon. Goodbye.
Thank you all.